My name is Tara Marshall, and this is my process speech. Everyone knows that raising a child is an ongoing challenge. However, parenting a child with ADHD can bring on bigger and more difficult challenges. During this speech, I'm going to share with you some signs, symptoms, and general information on children with ADHD, as well as pass along some tips and effective ways to help deal with this disorder. We all know that kids can't sit still, they never seem to listen, many of them don't follow directions no matter what, and blurt out things at inappropriate times. They are labeled most of the time as troublemakers, lazy, and undisciplined. It is also normal that children forget their homework, daydream, act without thinking, get fidgety at the dinner table. However, inattention, impulsivity, and hyperactivity are also signs of attention deficit hyperactivity disorder, also known as ADHD. ADHD can lead to problems at home, at school, and affects your child's inability to learn and get along well with others. The causes of this are still unknown, but we do know that it is a developmental disorder involving an individual's inability to be able to control activity level, behavior, and concentrate in the appropriate ways. Generally, it is genetically predisposed, and it can also occur from history of trauma or brain injury. Another important factor is that usually a child with ADHD is not only suffering from this particular disorder, but it is also suffering from one of several other accompanying disorders such as dyslexia, learning disabilities, or even Tourette syndrome. The first step in the process of determining whether one has ADHD begins by identifying the signs or symptoms compared to what is normal behavior and age appropriate. This can usually be done by parents and staff at school, and some signs may include but are not limited to inattention or easily get distracted, disorganization, daydreaming instead of listening, rarely following instructions, careless mistakes, forgetfulness, losing things frequently, moving on to different projects without finishing the first one, hyperactivity, impatience, getting fidgety, squirmy, and have trouble sitting still. Also interrupting others and has trouble staying focused are other symptoms of ADHD. Since each of us can possess one or more of these signs on a daily basis, it is hard to determine or even diagnose what is ADHD and what isn't. A correct diagnosis of the disorder requires that the signs or symptoms repeat regularly over a long period of time. There are also age guidelines for determining what is normal and what is not. For instance, most ADHD behavior occurs around the age of 6 and lasts an average of 6 months or longer. The behavior also needs to point out deficiencies in two other important areas in life, such as behavior in school, academic performance, and at home. If concerns increase, it is advisable to obtain the opinion of an experienced physician to see whether or not the child's behavior is normal or not. Your observations along with the school staff combined with the physician's observations altogether will make an overview over what is going on with the child. The second step of the process is to notify the family doctor or pediatrician. This person will be a qualified, trained professional who can perform the necessary testing in diagnosing mental disorders such as ADHD. Examples of other people that are trained in this area include psychiatrists and or physicians, behavioral neurologists, and clinical social workers. During this process, both you and your child's teacher will fill out papers on the physical, mental, emotional, and cognitive well-being of your child, and the doctor will also do some testing of their own. Once the testing and observations are done, the results and whether or not treatment is needed or wanted will be discussed. If a child is diagnosed with ADHD, one option of treatment is the natural remedy that requires no stimulants, drugs, or medication to be taken. This helps the body improve connections with the nervous system by staying consistent with a healthy diet, which includes paying close attention to the sugar intake and also allergies. Exercise, sleep, and discipline issues are also important factors of an ADHD child. Although word has it that it is amazing how quickly you can improve ADHD behavior with a natural remedy, the standard treatment for ADHD is medication. Determining the best treatment for your child and your family is an important decision and may take time. Since side effects do occur with medication, a particular prescription cannot be effective in every case. Different people get different results. Therefore, it is important to find the right combination and dosage for the patient. Stimulants and drugs are proven to be safe and effective, but as with any medication, children do need to be supervised while under the influence. Some people disagree with putting their children on medication for different reasons, but a few positive aspects of doing so is that it is guaranteed to help your child stay focused for a longer period of time. It will enhance cognitive ability, limit distractions in their environment, decrease hyperactivity, and help greatly with self-control. To understand ADHD and how it affects you and your loved one, it is important to learn as much as possible about the condition. You can search the web, ask your doctor, and read up on brochures and other resources for helpful tips and facts about the attention deficit hyperactivity disorder, also known as ADHD. This information will help you greatly understand the condition, recognize the symptoms, and learn about treatment options. Thank you.